Most people don't realize that pancreatic cancer is one of the deadliest cancers today, outpacing even breast and prostate cancers in mortality across many countries. Despite its deadly nature, pancreatic cancer remains largely unknown to the public and rarely discussed. But imagine this: by learning just a few key symptoms, you could help yourself or someone you love catch this disease early, before it's too late. Pancreatic cancer is often called the silent killer because it hides quietly inside the body. With a 5-year survival rate of only about 12%, it claims over 65,000 lives each year in the US alone. What's even more alarming is that nearly 80% of patients ignore early warning signs, mistaking them for common discomforts until the disease has spread. But recent research reveals many symptoms appear 3 to 6 months before diagnosis, providing a rare chance for early detection. Your pancreas may be small and tucked deep inside, but it plays a critical role in digestion and blood sugar regulation. Recognizing the subtle signs it sends is crucial. In this video, we'll uncover 8 surprising signs of pancreatic cancer you might overlook. Knowing these could save a life. Now let's dive in. Number 1. Digestive problems. The pancreas produces essential enzymes that help break down the food you eat, especially fats, proteins, and carbohydrates. When pancreatic cancer develops, it can block the ducts that carry these enzymes to your intestines or reduce enzyme production itself. This disruption causes persistent digestive problems like nausea, vomiting, bloating, and indigestion. One key sign is steatorrhea, pale, greasy, foul-smelling stools that float because fat isn't properly digested. These symptoms may also cause a loss of appetite and unexplained weight loss as the body struggles to absorb nutrients. Unfortunately, these digestive issues are often mistaken for common gastrointestinal problems, so they're ignored until they worsen. But if you experience persistent digestive discomfort, especially alongside weight loss or changes in stool color or texture, it's important to seek medical advice. Early pancreatic tumors interfere with digestion long before other symptoms appear. Paying attention to these subtle but persistent signs could help detect cancer early, allowing more effective treatment. Number 2. Fatigue or physical weakness. Fatigue caused by pancreatic cancer is not like everyday tiredness. It's a deep, overwhelming exhaustion that rest and sleep cannot relieve. This severe fatigue happens because cancer cells consume large amounts of the body's energy and nutrients, leaving you depleted. Additionally, pancreatic cancer often causes inflammation and disrupts metabolism, further draining your strength. Many patients report struggling to complete simple daily tasks, such as walking short distances or climbing stairs, which they previously managed easily. This physical weakness can develop gradually and may be accompanied by muscle wasting, making you feel frail. Emotional symptoms like anxiety or depression often worsen the fatigue, creating a vicious cycle. Because fatigue is a common symptom in many illnesses, people sometimes dismiss it or blame it on stress or aging, delaying medical attention. However, persistent, unexplainable fatigue that worsens over weeks or months should prompt a medical evaluation. Recognizing this profound weakness as a possible warning sign is crucial because it often appears early in pancreatic cancer's course, before other symptoms become obvious. Early diagnosis can significantly improve treatment chances. Number 3. Fever and shivering. Unexplained fevers and shivering can be a subtle but important warning sign of pancreatic cancer. When a tumor grows in the pancreas, it can cause inflammation, which triggers the immune system to respond by raising your body temperature. This often results in intermittent fevers, sometimes accompanied by chills or shivering, that come and go without an obvious cause. Unlike typical infections where fever follows a clear pattern and responds well to treatment, cancer-related fever can fluctuate unpredictably and persist for weeks. Sometimes, fever appears along with night sweats, fatigue, or general malaise, making you feel constantly unwell. Additionally, if the tumor blocks the bile duct, it can cause infections and worsen inflammation, intensifying fever episodes. These recurrent fevers are a sign your body is fighting something serious and should never be ignored, especially if they persist despite antibiotics or other treatments. Although fever is a common symptom for many conditions, in combination with other pancreatic symptoms like abdominal pain or jaundice, it becomes a red flag. Consulting a healthcare provider for unexplained recurrent fevers can help identify pancreatic cancer earlier and improve treatment options. Number 4. Blood clots. Pancreatic cancer significantly increases your risk of developing blood clots, a dangerous and often overlooked complication. Tumors produce substances that make your blood more likely to clot, a condition called hypercoagulability. One of the most common types of clot in pancreatic cancer patients is deep vein thrombosis, DVT, which usually forms in the legs. Symptoms include swelling, redness, warmth, and pain in the affected limb. These clots may seem minor, but can become life-threatening if a piece breaks off and travels to the lungs, causing a pulmonary embolism. Signs of a pulmonary embolism include sudden shortness of breath, chest pain, rapid heartbeat, and even fainting. Pancreatic cancer's ability to cause blood clots is well documented, but still not widely recognized outside medical circles. Because blood clots can occur before cancer diagnosis, their appearance without obvious cause, especially in older adults, should prompt a thorough cancer workup. If you notice swelling, tenderness, or unexplained breathlessness, seek immediate medical attention. Understanding this link between pancreatic cancer and clotting problems helps patients and doctors identify the disease earlier and prevent life-threatening complications. Number 5. Swelling of gallbladder or liver. When pancreatic tumors block the bile duct, bile can't flow normally from the liver and gallbladder into the intestines. This blockage causes bile to back up, resulting in swelling and enlargement of both organs. The gallbladder may become noticeably swollen, and liver enlargement can sometimes be felt as a firm area below the right ribs. This bile buildup also leads to jaundice, a yellowing of the skin and eyes, because bile contains bilirubin, a pigment that accumulates in the blood when the flow is obstructed. Swelling in these organs often causes discomfort or a feeling of fullness in the upper right abdomen. These physical signs are significant because the liver, gallbladder, and pancreas work closely together, so problems in one can affect the others. Doctors often detect this swelling during physical exams or imaging tests, like ultrasounds or CT scans. If you experience swelling or tenderness in the right upper abdomen, especially if paired with jaundice or other symptoms, it's important to get checked promptly. Early detection of organ swelling caused by bile duct obstruction can help identify pancreatic cancer at a stage when treatment is more effective. Number 6. Gas or bloating. Persistent gas and bloating can be a sign of pancreatic cancer, especially when accompanied by other digestive symptoms. The pancreas produces enzymes essential for breaking down food, and when cancer blocks these enzyme secretions, digestion slows down. Food remains in the stomach or intestines longer, fermenting and producing excess gas. This causes uncomfortable bloating and abdominal distension, often making clothes feel tighter or the belly visibly swollen. Early satiety, feeling full after eating only a small amount, is also common, as the tumor may press on the stomach or intestines, reducing their capacity. Unlike occasional bloating from diet or stress, pancreatic cancer-related bloating is persistent and doesn't improve with over-the-counter remedies or dietary changes. Patients often report nausea or mild abdominal pain alongside bloating, which worsens after meals. Because these symptoms overlap with common digestive conditions, they are frequently ignored until more severe signs develop. But persistent, unexplained bloating and gas should not be dismissed, especially if you also notice weight loss or loss of appetite. Paying attention to these subtle digestive changes can provide a crucial opportunity to diagnose pancreatic cancer early and improve prognosis. Number 7. Tummy or back pain. One of the more recognizable symptoms of pancreatic cancer is persistent pain in the upper abdomen or middle back. This pain is often described as a dull, gnawing ache that starts gradually and intensifies over time. Unlike common stomach pain caused by indigestion or muscle strain, pancreatic cancer pain typically worsens after eating or when lying down flat. This occurs because the tumor grows and presses on nearby nerves and organs, sending pain signals to the back as well as the tummy. The pain can come and go initially, but as the cancer progresses, it becomes more constant and severe. Some patients describe the sensation as a band-like pressure across their torso. This distinctive pain pattern helps doctors differentiate pancreatic cancer from other causes of abdominal discomfort. Unfortunately, because it can mimic other less serious conditions, many people delay seeking medical help. However, if you experience unexplained upper abdominal or back pain that does not improve and worsens with meals or rest, it's important to get a thorough medical evaluation. Early recognition of this pain pattern can lead to earlier diagnosis and more effective treatment. Number 8. Dark yellow or brown urine. A subtle but important symptom of pancreatic cancer is dark yellow or brown urine, often resembling the color of tea or cola. This occurs when tumors block the bile duct, causing bilirubin, a yellow pigment produced from the breakdown of red blood cells, to build up in the bloodstream. Normally, bilirubin is eliminated through stool, which gives stool its brown color. When bile flow is obstructed, bilirubin is instead filtered out through the kidneys, darkening the urine. This change in urine color often appears before the skin or eyes turn yellow from jaundice, making it an early warning sign. Many people ignore dark urine, attributing it to dehydration, certain foods, or medications. However, if your urine remains dark despite drinking plenty of water, you should seek medical attention. This persistent discoloration signals a bile duct blockage that may be caused by pancreatic cancer or other serious conditions. Recognizing this early sign is critical because it can prompt further testing and potentially lead to an earlier diagnosis, increasing the chances of successful treatment. Before you go, I want you to remember something important. Your body is always speaking to you. Sometimes it whispers, sometimes it shouts, and the key to protecting your health is simply learning how to listen. Pancreatic cancer is known as the silent killer for a reason. But today you have learned that it's not always silent. It leaves clues, subtle, strange, and easy to overlook, yes, but clues that can be caught if you know what to look for. And now you do. So if any of the symptoms we've talked about today feel familiar, don't second-guess yourself. Don't delay. Don't hope it goes away. Speak to your doctor, ask questions, insist on answers, because when it comes to pancreatic cancer, early action can mean the difference between life and death. If this video helped you, even a little, please take a moment to like it, subscribe to the channel, and turn on the notification bell. That one click could help this video reach someone else who's searching for answers, and maybe even save a life. And if you've experienced any of these symptoms or have a story to share, drop it in the comments below. Your voice could give someone else the courage to get checked. Stay informed, stay alert, and above all, stay empowered. I'll see you in the next video.